My name is Giulia Hardy, for who doesn't know me. I'm a clinical psychologist and I'm a family therapist for CAMHS. And I'm presenting today with Charlotte.
I'm Charlotte Friel. I'm an educational psychologist, so I work for the education department, not in CAMHS, but I do a lot of work around school anxiety. And I work across schools in Guernsey. So my specialism is in child development and learning.
And we also work together with ADHD,
We
isn't
do a lot
it?
of work together around ADHD.
Yes. And then there is Katie Shepherd. And
A genuine young person.
yes, who kindly came to speak with you about her own experience. She was an ex-client of CAMHS, and she was accessing CAMHS because of anxiety. So she will speak about, a bit about her experience. Yeah. Right. So. Before we start, how many of you have experienced anxiety? At least once in their lives? Most of you. I can see that. But I'm sure that not all of you have spoken about their anxieties. So this is what actually makes children and adolescents quite confused. It's like the big unspoken problem that everybody's got, but no one talks about. So most of children and adolescents think that they are the only ones that are experiencing anxiety, where instead all of us have at least once experienced anxiety. And why not so many people speak about it? It's because it's actually quite difficult to define exactly what anxiety is. It's a little bit like fear, but much more intense. And I like it to explain it talking about three components of anxiety. So thoughts and feelings, body signals, and behaviors. So what do you do with these thoughts, these feelings, and these body signals? So the response that we take. In regards to the thoughts, normally people who experience anxieties are a bit like a dog chasing his tail. So they just think and worry about things. And they are stuck in this vicious cycle of thinking and thinking about the same thing and not finding a solution and getting more and more aroused, so more and more anxious. And while they are doing this, they activate their nervous system, which obviously activates a production of hormones, which then produces a lot of changes in our body. So you might start feeling sick, shake, or each one of us has got different ways to respond to anxiety. So one of the most important things is to identify which are the changes in the bodies that we are experiencing, because then we can actually prevent the situation from escalating, and we can actually detect when we are feeling anxious and do something about it. So we've got thoughts and we've got body signals. And then we've got the third component, which is behavior. So what do we do with all these thoughts and these changes in our bodies? And all of you might know about the fight, flight, and freeze response, which is in reality a response that we do when we are facing a threat. So sometimes the response to the anxiety can be a combination of one or two of these. So we might fight, so the child or the adolescent might fight with their parents. They might argue because they don't want to do something, but at the same time they might flight, so they might try to avoid doing something. And sometimes, more rare, can happen that they actually freeze, so they don't do anything and they are actually stuck. So they're not able to communicate, and when parents ask, what are you feeling, they're not able to actually express what they're feeling. Normally, the flight response is the most common. So normally, children, adolescents, and adults who experience anxiety, they try to avoid doing things. So they feel that there is a threat, which could be symbolical, not a real threat. Obviously, with anxiety, it's not a real threat. and they try to avoid the situation that actually has triggered the anxiety. So avoidance is the most common behavior, which gives a sense of relief there and then in the short term, but in the long term can cause the anxiety to grow, so to become bigger and bigger, because obviously by avoiding doing something, we reconfirm to ourselves that we are not capable of doing something, so we get more and more anxious. So avoidance is the most common behavior and the most common response to anxiety, but also the most damaging, because in the long term doesn't help the self-confidence and self-esteem to actually overcome the anxiety. Because most of the time, as each one of us feel anxious at times, the best treatment is actually the contrary, not avoiding situations, but actually facing them, because that reinforces, it has exactly the opposite effect. It increases the self-esteem and the self-confidence. So if I'm anxious about doing something and I actually do it, then I know that the second time I will have to do the same thing. I feel confident that I can do it because I did it the first time. So obviously in the long term helps a lot. What is important to say is that anxiety sometimes can be a part of a much, much bigger problem. So which could be social anxiety. So school anxiety could be a component of a much bigger problem, which could be social anxiety. So the child or the adolescent is not only anxious about going to school, is actually anxious about going for clubs in the afternoons or being in social situations. And why? Because he's scared of feeling embarrassed in front of other people, or feeling judged, or other people are looking. All sorts of like negative thoughts that comes along with the social anxiety. So we treat school anxiety, but we also need to see and treat the big picture, which is the social anxiety. It could be part of a separation anxiety. This is normally common with young children. When children have been exposed to a traumatic separation, so they're actually scared of going to school because they need to separate from their parents again, and this kind of recalls vivid traumatic experiences that they had, or they know, for example, that one of the parents is not well enough to be on his own at home, or they're scared about not providing for the parent, not being there for the parents. So there is a separation anxiety. And it can be also part of a reward time, in a behavioral problem, when when it's rewarding actually not doing something. So obviously if a child doesn't want to go to school and then at home can stay at home and watch TV and be on the computer, a lot of children and adolescents at the moment, they've got friends online. So obviously if they can be at home and be in contact with their friends, that's rewarding for them. So obviously school anxiety, yes, it is anxiety in that situation, but it's also like a behavioral problem. It needs to be treated as a behavioral problem.
I'm going to talk a bit about the school bit of school anxiety, because that's where I work in. So the key thing around school anxiety, I think, is when that problem happens, you can feel kind of quite isolated and don't really know who to go to. And a quite common experience of parents and young people that I work with is they try to discuss it with their teacher or the school, and they get messages like, well, everything's fine, or kind of feedback that suggests that either things are okay or maybe there's some fault within the family that's causing that. So we've done a lot of work actually with schools around that, and hopefully they do now understand that how a child is in school does not necessarily reflect whether they have anxiety or not, okay? So the key thing that we would say is, in terms of returning or going back to school, there are key people that you need to speak to. Within the school, I would suggest most often you'll probably go to your class teacher, but there are two other people that you should probably talk to if you think this is a bigger problem. The first is the school's special educational needs coordinator. Okay, so if you ask who that is, each school has one, and they talk with services like mine who can help within school. And even sometimes I don't even kind of work with that child, but I'll give them some advice, and that in itself has been helpful to resolve the problem. The other is their school nurse, who come into the schools and are there. So if there's a problem going on and you think actually you might want some advice, the school nurses are actually trained in some work they can do with you to help with anxiety at the early stages. We would much rather that families get that support at the early stages before a problem becomes too big. It's better for everyone, really. And the other one that you might see is a school attendance service, so the school attendance officer, which used to be known as the education welfare officers, and everyone's a little bit scared of them. They're actually quite friendly, and if they're involved, they also have the same training as the school nurses. They would only be involved if the school attendance was affected to quite a significant extent, okay? They work jointly with the educational psychology service. They do often come and ask me about cases like this, and we support them in that, okay? Right, so how do we get back into school? Well, going back into school, the key point that we would say is that a back to school plan should be done. And we've done a lot of work with the schools and with other professionals around what that should look like. So the return to school plan involves everyone working together, so that's you guys, families, you as young people, if you're here, should be part of that as well, the school and anyone who's supporting you, so the school nurse if you've got that involvement, or the school attendance officer. If you've got someone like me, it might be myself as well. And what we would look at is actually quite a quick and rapid return to school, okay? So in the past, what you might have seen as long-time, part-time timetables, we wouldn't do that in the longer term. What we would do is build up slowly but steadily. And if things look like they're going wrong, we kind of cease it a bit, keep it in the same place, get back to a place where things are good, and then we move up a bit, okay? So we try to do it as quickly as possible, but also sensitively, okay? The key thing that we would say is quite often children with anxiety do have a number of medical reasons why they're absent from school. So because of the hormones that go around their body, the stress hormones like cortisol, it actually puts their immune system under quite a lot of pressure. So they are more prone to infections and things like that. So often you can have parents saying they're often sick, they're often unwell. It is important that if you think there's a genuine underlying medical reason for why your child is having difficulties getting into school, that is investigated and checked out. So for example, I have seen some children that I've worked with who've presented with quite unusual forms of epilepsy that could look like a tearful, distressed kind of behaviour. So it's things like that that could be there. So it is important that if you think there's something there, that does get checked out. And again, the school nurse or the school attendance officer can help you do that because they can refer you on to people. The key thing that we would be asking you as families and you as young people as well, if you're here, is about what are the causes of your anxieties? Now, that's not always easy to answer. You might not know, okay? But if you do, sometimes there's a really clear one, like this person is mean to me, or I don't like that lesson, or I don't like being in this bit. Then we can address that quite simply. But then the other thing is, what can we do to help? So what helps you to manage your anxieties, and how can we put that in place in school to help make you feel better? Okay, so we'd work together on a plan that would look at that. And just so you guys all know the kind of things we tell schools, I've actually put some copies of the leaflets that we have for schools at the back, which includes the advice we give them for doing a back to school plan with families, as well as advice for you as parents on how you do that as well. Okay. When the school nurse and the education welfare officer or the school attendance service, as they now know, do get involved, just so you know, some of the training that we've done with them, if you feel there's an anxiety issue, is they can do a specific kind of interview with you, looking at the experience and history of anxiety. They might also do some anxiety assessments with you and your young person, just to check how much of a concern this is. And they might also provide you with some of the information at the back and do a little bit of extra work with you around that. So they will do that to identify how big is the problem. And for some people who are experiencing anxiety, it might be at the level where we would suggest, yes, that should be a referral to CAMHS. So we would still work with you and help you. We're not saying we wouldn't do that, but at the same time, you might need some input for them as well. So it is important that if it's at the level of what we'd call an anxiety disorder, which is kind of at the level of a mental health issue, that you get that input and support. At the same time, if it's not at that level, that doesn't mean we don't, in education, who are working with you, treat it as a genuine anxiety issue and work with you around it, if you see what I mean, yeah? Oh, sorry, that was quite good, that last one. So as you saw, it's okay to feel that way and it's okay not to like it on the last slide. So that just gives you the sense of feeling overwhelmed when we're doing back to school. That's a bit how it feels, a bit lost at sea. So we try to look at ways that we can manage that. So the really important thing of managing that sense of overwhelmness are some key things, which is around having positive relationships. And that's kind of, I know that sounds really, really obvious, that you need to have a positive relationship, but that's sometimes difficult to do with the school. It might be difficult to do with a class teacher you don't know. So it's about finding can you build that relationship with? Who do you trust within the school? Who do you trust within the services that work with you to help you with that, okay? And we say exactly the same thing to the school as well. It's really important to have that positive relationship and be non-judgmental but supportive. Talking about worries, okay, we're very good at saying, I'm worried about Christmas coming up, which I always worry about because I come from an enormously large family with lots of step siblings and all over the place, so organising it is a bit of a nightmare. So we'll say that, but we won't say, during the day today I had this general sense of anxiety and worry. I was a bit on edge and I'm not really sure why. And how many times do teachers say that in school? So, you know, actually we don't really talk about it in that non-specific way as a general feeling that we might have. When we are talking about worries, it is really important to be non-judgmental because someone's experience is quite important. They wouldn't be talking about it if it wasn't. And actually using quite open questions, kind of why questions can be quite helpful as well. A lot of young people that I work with find it really hard to tell you that verbally, right? I would find it hard to tell someone my most intimate things straight to their face, especially if I don't know them that well. So young people that I work with might write it down, they might email it, they might prefer to text it, some of them draw pictures. Whatever works for them, I would work around that and ask them about that. And sometimes I have to be quite specific with them about what does work for you. So if you can't go to school today and the school has said you've got to phone them, are you really going to phone them? Would you prefer to text them? Would you prefer to email? What's going to work for you, okay? Now, working on thinking is a tough one, okay? And if anyone miraculously finds how you can change thoughts, do let me know, okay? But it is possible to notice thinking, and that's the really key thing, okay? And the first thing that we start doing is looking at spotting those anxious thoughts. So recently I've been working myself on spotting the thoughts in my head, the self-critical ones, and where it's kind of saying things like, yesterday I did something and then realised that I hadn't done something I thought I'd done, and I said to myself, oh, that's so silly. And then I was like, it might have been other words, but never mind. So that was so silly. And then I was like, but that's the voice in my head telling myself that I'm being that way. Actually, it wasn't. It was just a mistake. So it's things like that, spotting those anxious thoughts, checking them out. How do we know that's really true? Can you really not go into school today? Why is that? What shows you that it's 100% true, okay? So I have a lot of young people who say they can never go in a classroom. So I'll say to them, what, do you know that's 100% true? And they'll go, yes, it is, it's 100% true. And I'll say to them, okay, so when was the last time you went in a classroom? Well, 4 years ago, okay. And have you tried to go in a classroom since then? No. Have you been in any situation with other young people? Well, yes. And then you start exploring the exceptions with them, and then you begin to find it's not quite as true as they think it is, okay? And then what's the worst thing about that, or what's the worst thing that could happen? Okay, so, you know, in the most extreme cases, I might start off with, you know, is the world going to end? No, it's not going to end. So what's the worst thing? And the worst thing, usually, not always, is that we are going to feel deeply uncomfortable, okay? But at the same time, we can cope with that because we've probably had times where we've done that before, okay? When we're working on thinking, we also look at having a go, so trying it out, testing it, seeing if it's true, like Giulia was saying about kind of facing those fears, those anxieties, having a step-by-step plan. What tends to happen with this working on change is that a lot of young people that I work with on anxiety just either don't want to tackle it, okay, they want to put it away, that hiding, avoiding, flight, or they want to do it all at once, okay? So they want to go into school, they want to be completely normal, this, that, and the other, and they want to do it really quickly, okay? And I'll do a lot of work with them about doing it a step-by-step way, because that's how we can make things sustainable. So if I try to do everything at once, I'll be over-juggling and something won't work, and I'm a psychologist and I haven't mastered that yet. So we do it in a step-by-step way, in a manner that they can cope with, making sure that they can, so they're not getting emotionally overwhelmed. And then the other thing that we'd look at is problem solving as well. So if something comes up, how are you going to deal with it? What are you going to do? Okay? Katie knows these ones, don't you, Katie? Okay, so we might use some power words, and those would be words like get or yet. So you haven't got, I'll never get back into school. You'll never get back into school. You haven't got back into school yet. Okay, I have to go to school today. No, you get to go to school today. It makes a big difference, okay? So we would work with these kinds of approaches, and when we're looking at this step-by-step way of getting back into school, like I said, we'll break it down, and one of the ways that I break it down is in a ladder approach. So I'd say, you know, step-by-step we climb a mountain. That's how we get to the top. If something goes wrong, so you've fallen off the mountain, you don't magically appear back on the bit you fell off. you have to climb back up again to the place that you were and then step up. So that's how we work in a staged way. We go, if something kind of feels a bit uncomfortable, we go back down to a level where we feel safer. We wait around there for a few weeks and then we go up again. So it's the same kind of principle. And we haven't got to the top yet, but we will get there. They make a difference to me anyway. And I think the really key take-home message that I always say to families and people that I work with anxiety is that if you keep going, you will start to manage your worries. It might not look the same as you expect it to, and it might not be the perfect solution that you were looking at, because the likelihood is if you are someone who's quite worried, you are going to experience anxiety at various different points and when you have a stressor, but you will learn ways of coping and dealing with those, which is hence why my young Katie here can manage kind of being here with you guys today. So I guess that's it really.